Hi everybody! Welcome on 10 Minutes on Menopause here in the Femoral US Facebook page. If you haven't been previously introduced in my last lecture, my name is Dr. Mora and I'm really happy to be back here again. We're going to discuss today about menopause, but we're going to focus or switch the focus to other symptoms that come with it. Menopause versus intimacy. What happens, why it happens, and what can we do about it? We discussed last week how menopause is due to a decrease on estrogen, or due to a hormonal imbalance that is produced because of the decrease of the production of an estrogen in our bodies. Women are a work of art in the inside and in the outside, but especially in our brain. Estrogen's influence in the body is so broad that the lack of it comes with a lot of symptoms. We discussed last time hot flashes, bone loss, what else? Headaches, but specifically, it affects the brain, even to the point to making us feel that the body temperature is rising on a hot flash, when actually, in reality, the temperature in our bodies is not rising. It is the effect of the estrogen in the brain that gives all of those symptoms, and the list goes beyond that. I mean, we could have night sweats, vaginal dryness, depression, and to the point of lowering our sex drive. As a matter of fact, there are studies that shows that the aging of the female brain starts with the onset of menopause, or that the aging of the reproductive female system goes in hand with the aging of the female brain. Do you know that only mammals outlive their reproductive stage of life? And I mean, sexuality is such a vital part of any female or human being. Like one of my patients said to me the other day, I don't know what happened to me. I used to be sassy. I loved flirting and fooling around with my husband. I couldn't even wait for the both of us to be at home at the same time. And as her, you may be asking, why? What happened? Is it aging? No, it is menopause. And it's menopause on the brain. About this, we can agree that all of the symptoms that you have been experiencing and the decrease in your sex drive is not your fault. Better yet, there is solutions to it and we can do something about it. Going back on last week's lecture, we focused on hot flashes and how it affects the immune system, or how it affects the quality of life. We also voted it as the most bothersome symptom. There are studies I'm going to talk about today of other symptoms that goes with the lack of estrogen in the body. That has studies that shows that is the guiltiest of producing low libido, or the sex drive killer. And the award goes to vaginal dryness. Let's point out that dryness does not only manifest in the vagina. It actually dries all mucosas in the body. So you're gonna have symptoms like dryness of the eye, dry mouth, which are usually symptoms that females experience throughout their lives, but it gets worse in menopause. Estrogen helps the tissue in the vagina to keep its elasticity, keep it lubricated. It makes it thicker, like a pillow. The lack of it, it's gonna take all of that out. So you're gonna lose elasticity, lose the lubrication, and even the color goes from pinkish to light blue. One would think that the most patients around the age of 40 come to the consult for the thin lines that appear in their skin. But actually they don't. most of my patients around the age of 40 comes to me worried about their sex life and their lack of lubrication, or as they may call it, their fruit has little to no juice anymore. Research suggests that about 20% of perimenopausal, menopausal, and postmenopausal women have vaginal dryness issue, and they seek for consultations for it. However, there are studies that show that this affects actually 40 to 50% of women in the menopause stage that don't ask. And then 90% of postmenopausal women have vaginal dryness. I mean, 90%. I think you can see the importance on switching the focus to bring this up. Vaginal dryness is a common problem that many women have in a point of their lives. It is something that happens. It's not disabling, but it could be really discomforting. And if leave untreated, it could bring some issues, like it could give you sores or aching, itching of the area, even by walking. There are other reasons for vaginal dryness that I just want to make you aware of. It could be menopause and, or close to menopause and, or just this. The constant consumption of antihistamines like diphenhydramine. These are like drugs that are used for allergies and secretions, flu-like, okay? These work by drying out secretions. So a side effect could be producing vaginal dryness. Another treatment that can also give you side effects of vaginal dryness and make it harder to produce orgasms are antidepressants. Yes, antidepressants. So if we know by now, by listening to these lectures, the lack of estrogen in our brain can produce depression. So maybe some of these patients that are being treated with antidepressants, the only thing they need is to balance their hormones instead of taking those antidepressants. Until now, we have discussed the causes of why the lowering of the sex drive and the produce of vaginal dryness, and like a little bit of why it happens, what happens. But we haven't gotten to the part of what to do about it. I'm gonna go from the most basic to the complex and divide that as it goes. So let's start from the basic. Diet. Studies have shown that following a Mediterranean diet goes a long way to help women's health in general, because its foods rich in good phytoestrogens such as nuts, sesame seeds, dates, and good news, even chocolate has good phytoestrogens, and this can help lowering the symptoms of menopause and also helping women's health in general. Drink plenty water. As I said before, it is basic for keeping anything in the body balanced. But think about it, in like focusing on vaginal dryness, if we are dehydrated, from where are we producing any lubrication? The other thing, it's like a common saying, but use it or lose it. Keep it playful with yourself or with your partner. The blood flow that comes to the vaginal area when you're aroused could help in the production of natural lubrication. So a good foreplay before having sex could lead to having better sex itself or making it more enjoyable. Lifestyle. I cannot underaddress the importance of exercising, but I'm going to explain why at menopause it is more important. Cortisol is a hormone that is the stress hormone. It is released due to stress, and it works perpendicularly with the estrogen. So if the cortisol goes up because we're stressed, then estrogen goes down and we need it to go up. So if we exercise releases another hormone called endorphin that it's sort of like a happy pill. So that will lower the stress for there, lower the cortisol, and leave space for the estrogen to climb its way up. All this might help mildly with the situation, but there's some women that are at a level that they need something stronger. So for these stronger treatments, I'm gonna divide it in two, the short term and the long term. The short term, they do not treat the root cause, and we are gonna have to hope that we have it with us the whole time. And this includes lubricants. Lubricants are used in the intercourse moments to help lubrication and make sex more enjoyable. We can use lubricants every day or every other day in the vaginal area to keep that area lubricated. If you're gonna go this route, I recommend you to use water-based lubricants, because oily-based lubricants can give you more irritation. I also like the ones that have hyaluronic acid, lactic probiotics, and phytoestrogens in them. Then, if you're not only having issues, right, on the area of lubrication, vaginal dryness, and it related to your sex life, and you also have other symptoms due to the hormonal imbalance, and you want to help your body fix itself, this brings me to the long-term treatment of the strong type treatments. My first recommendation will always be Femoral. It is a non-hormonal, a completely natural product, safety to use, that it has proven that it has even worked in the most severe cases of vaginal dryness. And as I discussed last time, it also works in lowering the symptoms of menopause, even in the first month of usage. If you weren't here for the last lecture, I'll just briefly show them to you so you know what I'm talking about. I have it right here. This one is Femoral Rejuvenate. This one I give to my patients around the age of 40 that starts with the symptoms of menopause. This one, it's Femoral Recharge, and it's the one that I use in my patients around the age of 50 that already have hot flashes and are on the menopause stage, plus all the symptoms that we're bringing along because of the decreased production of estrogen. Then lastly, we have this one, which is Femoral Unstoppable. This one is I give to my patient around the age of 60. They don't think about the hot flashes, but now they have to think of their bone health and the vaginal dryness. The three of them work for vaginal dryness because it's an active ingredient that balances the hormones, and for that, it treats the symptoms that you are having because of the hormonal imbalance. Another type of treatment in the long-term treatment options is the topical synthetic estrogen creams. We also discussed synthetic hormones on last lecture, so I won't go deep into this either. But I do want to remind you that the use of synthetic estrogens or hormones comes with a lot of contraindications and risks, especially if you're a woman with history, like personal history or family history of having breast and ovarian cancer. Please ask your physician before even considering this as your option. Lastly, the do not for treatments, like don't do it. I'm gonna tell you a little bit of a story. So I had a patient that would come constantly to my private consult because she was having recurrent vaginal infections, not the ones that are sexually transmitted. She already had issues with her vaginal dryness, like lubrication area, which we were treating with Femoral. And then, like, we were on and on going on to her routines, like what would she do every day with like her cleaning habits, things like that. But she forgot to tell me that every time that she was gonna get into action with her husband, before that, she would use a vaginal douche. Vaginal douches is kind of like a soapy liquid that you insert in the vaginal area that it's supposed meant to clean the area. Sometimes it has even perfumes to it. This is only more irritative for the vaginal area. But the vagina has healthy bacteria itself, that it's like the protective barrier that it has naturally. If you keep like pushing douches into it, you're gonna leave it unprotected of that natural barrier that it already has. And that for that, you could have a lot more vaginal infections. The other thing that I want to talk about to end this lecture is underwear. You know that like synthetic material underwear that we love, that we buy in Victoria's Secret because it makes us feel all sexy? Great. Just use it for the sexy times when you know that you're gonna take it off soon enough. For daily basis, we need to choose cotton underwear. Underwear that keeps us fresh and breathable, you know, that it let the wind flow around there and keep us dry. Polyester materials, that is usually what it's made, the synthetic material underwear, can be clingy, and it could like irritate the area, makes you sweat a lot too, and could also lead to higher risk of having urinary tract infections. Okay, so I think we're done for today. I hope you found this useful. If you have any questions, please leave comments and questions below. Please join us to our next lecture. And if you can, and you didn't watch it, go back on the live lecture on April 7th, so that you can go up to date with the subjects and don't lose any material in there. Also, as every lecture, remember the 10 first women to write to femoral.us, write them a direct message and write them your name, your address, your most bothersome symptom, especially if you're in the ages around 40 and 70, so that you can get your first month of femoral treatment for free. Until next time, stay safe. Bye-bye.